So let's talk about inflammation, right? Inflammation, this is when your immune system is responding to an injury in your body, all right, in any part of your body, all right. We know the blood system, the blood flows in our body everywhere. We have the veins, we have the arteries, which controls the blood, all right. So the blood is flowing everywhere in our body, and whenever there is any cut or any issues in our body, the blood is flowing out, all right, because it is in that area of the skin anywhere, all right. If it's fracture, the blood is there, right. And the content of blood, one major content of blood is the leukocytes, the platelets, all right. These are the much more enhancements in aspect of immune. They are substances of immune system, all right, which helps in protection of the area, healing and repair, So now, how does this occur in a normal, let's talk about the normal system, like a country, for example. Every sector in a country have something called the police, all right. So the police now is having the guns. They have their duty is to protect the citizen of that area, because most police station does not have enough equipment or enough men who will take care of a big state. So they have a district, each district, right. So if there's any breakout, any issue, like let's say for example there is a robber, and you call the police, hello police, there's a robber in my area, I want you to come ASAP to help handle this issue, right. So the police is going to come, and what is the police going to do? The major work of the police is to get rid or arrest the robber. They will try to stop the robber. But in a case where the police can't on their own, on their district, help prevent that situation, guess what? They are returning back to their DPO, sending a message to the DPO. The DPO will send a message across to the nearest police station to help. If they can't, they are sending a message to the states, all right, the state controller, or I don't know what you might call it in your own country, and this state controller will be the ones to send the message across to other neighboring police stations to help. They will know the amount of men they need for the operation, right. But if that is not the case, if the issue is bigger and beyond the states to control, now the governor or the state's representative of the police will send a message to the higher authority in the federal level, and the federal level will be the one in enhancing the army, because you can't ask other police to leave their positions, right. You have to call the army, right. Then in that case, we are talking about the leukocyte is coming first, the platelets is now coming second, and there's other antibodies in this body which helps to for healing and repair, all right. So all this will combine together. Now the military is now coming. The military will be the one to handle the terrorists, because the government has been funding the military, all right. So I'm just trying to break it down so that anybody will understand how it works. It's the same way it works in the body, all right. Now, what are the signs of inflammation? There are 5 signs of inflammation you need to know. We have the redness, we have the swelling, we have heat, we have loss of function. Because if you're having injury in your thumb, you will not want to use that thumb to press a button, right. Pain is there, so loss of function is there, right, because if I press it, there's a pain. Another sign, pain is there, right, sign of inflammation. We have 5 basically, all right. So that is just it. I just want to talk about inflammation to make anybody who is not knowing or have not understood it that term understand it more better. But another major sign of inflammation I want to talk about, which I think they should have included, fever. Fever play a big role. How does fever play? Fever is just like the media in the country, alright. So let's say there's a terrorist attack. Guess what? The media already have the detail. And guess what? BBC, CNN, these channels, they are the first to approach to the site, and they will say, okay, there's a terrorist in this place, and they are taking pictures and they are making everybody know. That is just how fever reacts. That's why I tell anybody who is having fever, do one thing. Don't take it for granted. Try to find something to stop the fever. On the process of stopping the fever, like let's say there's a little terrorist attack, and you nullify it, the government reacts so quickly and stop them or capture them. Then the other people who are planning to invade will be like, oh goodness. Or on the process of you capturing that first terrorist, you detain the terrorist, and the terrorist will reveal some information and tell you, okay, this is this is that, this is how to apprehend them, this is where to go, blah blah blah, So the police or the government will be one step ahead and will capture others before they act, because he will expose their plan if you torture him very nicely. That is how it works in the body. And somebody might say it's a lie, but I'm just trying to make you understand that is how it works in the body. Because when the white blood cell is there, white blood cell have attacked any foreign bodies that invade the body. Now white blood cell has recognized this person, and the message is sent across the whole body. If you see this person, don't take it lightly. Deal with that person. Now any foreign bacteria is in danger, even if they are, like say the white blood cell is attacking at the head and the leg side. Any bacteria of same type is in danger. That is how what is it called, that is how our vaccine is being formed. All right, they actually, when making a vaccine, they don't use live bacteria which is healthy and strong, because if you use live bacteria, most people use live bacteria, but the live bacteria have to be weak. All right, and it's risky too, because they can come to the body and they can be stronger if in case the person is not having substantial immune. Right, but most people, they don't use that live bacteria which is so healthy and strong. Rather, they use a very weak bacteria or a dead bacteria. What are their goals in making this vaccine? Like, let's say COVID-19 is happening now. You can't just use live COVID-19 and inject in somebody, right? You have to use a weak COVID-19. So what are their goals of making this? They are making it so that your immunes will identify this. It's like identifying the terrorists and you're putting them in their pictures or their posters or writing something about an article about them. So anywhere they go, you know their face. All right, so anybody who sees them will just call the police. Hello police, I'm finding that person you're looking for here. If some police station will say this person is wanted, all right, they will say I'm finding that person here, come and deal with the threats. All right, police will just come immediately, the immunes will just come immediately. So that is how most of our vaccines are being formed. All right, so guys, let me not waste your time. I was just talking about inflammation. All right, thank you for watching.